The major disadvantage of the current surgical closure techniques are that, or the major, is that it leaves a scar. That scar can, on one end of the spectrum, be cosmetically unappealing, and on the opposite spectrum, actually leave a painful, itchy, or otherwise symptomatic scar that is actually undesired. And I think that with the current technologies that we have, which are primarily either sutures, staples, or even a steri-strip placement, that we have not been able to overcome those barriers. Photochemical tissue bonding, or PTB, otherwise known as Nano Suturing, is a technique where we're utilizing a light source and a light-sensitive dye to actually close a wound. There are no sutures placed. And as a consequence of that, the patient actually experiences less irritation, less inflammation. So the patient comfort is great. I think that patients would like it because they don't actually have to come back in 2 weeks to get the sutures out, so it saves them time and money. It is going to open up the door to allow us to actually render treatment in areas that we may not have felt as comfortable placing sutures in before, though we may have had to do so. Those areas include the face, where I think we've characteristically wanted to be and should be very careful in the placement of sutures because of the potential for scar formation. I think this will be absolutely vital and valuable because, again, it could be in an ER setting where a physician could easily apply the dye, emit the laser, and create a seal for a wound that would not require the patient to undergo a lot of distress with the potential for the placement of the sutures. To be able to actually close a wound with a light and a photosensitizing dye is just miraculous.